starting to see some reopening of practices, see people being brought back on, or see practices start to shift their staffing. So now is an interesting time to start to have conversations among the leadership of these practices. And so we wanted to have a forum for you all to talk amongst yourselves, to share the again, the opportunities, but also the obstacles that you're facing. Nick, would you like to share some of the things you're seeing right now?
Where do we start?
Yeah, I know you're very busy. Some of the things you've been talking about were how practices are bringing staff back on, and how payroll is changing with regards to how they handled the PPP loans and things like that.
Yep. So practices in general, and we can open it up for discussion. So if we look, let's just look at it from the aspect of the MGMA and the bodies of knowledge. So if we take the human resource management aspect of it and how practices are being affected at this moment, what is everyone seeing from an employee engagement perspective, from an employee risk management perspective, and how are you being able to kind of manage through the COVID concerns with employees that may be affected by the FFCRA, those type of issues? Guess I'm just kind of opening up for discussion. I want to hear what everybody has to say.
Yeah, so I just got a message too that that some mics are not working. So feel free to use the chat box as well to share ideas or questions or suggestions. We can make sure everyone knows that the chat box, that is also a means to communicate. Does anybody have any thoughts about Nick's question? And you can feel free to share your video as well. We can all talk about Nick's sweatshirt if we want.
So I know that everybody with less than, is everybody on the line work for a practice or do they work for an organization? So Robert, Kathy, and Jim. A healthcare organization.
A practice. This is Kathy.
So you're probably dealing with the PPP at the moment, correct?
Yes.
What type of challenges have you seen from a staffing perspective? Did you end up furloughing employees, or did you bring them back as soon as you received the PPP?
They were furloughed, and I brought everyone back, not necessarily working their full hours, but except for 2 employees that chose to still stay furloughed. They have new babies, so I kind of let that go. And then, but I have been, even though since the time that we got the PPP, even though they're not working their full hours, they're getting paid for their full hours. So they were able to collect unemployment prior to that for any less hours or furloughed time. And then, and then when that's done, we go from there, I guess.
And what type of practice are you?
Pediatrics.
Pediatric, okay. And did you have any challenges bringing employees back from being furloughed?
Most of my employees were still working, even with decreased hours. I didn't have a whole lot of furloughed employees, so we did put an incentive for the employees that continued to work. And so once we got to the point where we got the PPP loan and we were going to ask, them to work more hours and bring back furloughed, the people that chose not to, they're not going to get that incentive payment when we do that at the end.
Okay. And you said you lowered your hours for staffing?
Yes.
And
Both
how
of
are you? I'm sorry.
Go ahead.
No, you can go
I was
ahead.
just going to say, I mean, we're usually open 8 a.m. to 7 p.m. Monday through Friday, and every Saturday morning and every Sunday morning. So our hours are shortened. You know, our office building actually closes at 6 now, and we're usually out by 2, 3 o'clock because of seeing less patients.
Mhm.
And we do have 2 offices, so the other offices, even half of that, like they work half a day. We're seeing, you know, we're slowly increasing. Our patients for well visits do want to come in, so that's good. So we are increasing our patient load.
Good.
Yeah.
And you're managing this through. How are you currently managing your employees in your staffing during the day?
I'm there. I don't know what you mean.
So are you managing staffing hours during the week with decreased patient loads? I know you were increasing it, you were coming on ramp up, or have you been managing their hours differently?
Yes. And actually, I had them, you know, had them working less hours. This week, I think this week might have been the first week where I put them to their regular hours. And so even though they're on their schedule, if we're finished early, then they just leave. But they're still getting paid for their total number of hours that they would normally work
Okay.
because of the PPP. That's how I'm doing it. I don't know if that's the right way, but that was my understanding, that you were bringing them back for the PPP to keep them off unemployment. So
Correct. Yeah, that was mostly the point, the perspective, and I know the application just came out for forgiveness aspect, but mainly the whole purpose of the PPP was to bring people back on payroll and off unemployment.
mm-hmm.
Bringing them back onto payroll, and then how are you going to? And this is not just a question for you, but for anyone else on the phone. How are you going to be managing your staffing moving forward, particularly from a risk management perspective, liabilities, and those type of questions are going to be mainly going into the summer and moving forward. That's going to be a big topic that a lot of practices are going to be considering at this moment. Would you agree, or do you have any suggestions? Anybody on the phone on the site Zoom have any suggestions for that?
I see that we just had a couple more join in, Melissa and Katie. I know Katie Allen is having some trouble getting her mic to work, but we can use that chat box if we want to. Nick just asked how people are managing bringing staff back on from a risk management perspective. Kathy mentioned that she had a couple staff that chose just to stay home because they had new babies at home. I see Carol Thompson just joined in as well. If you aren't able to use your microphone or video camera, computer camera, you can use the chat box to join the conversation as well. Anybody want to talk about how they're managing staff risk or any other topic?
I feel like we should have Brian on for this.
I know.
Because we really look at it from a liability perspective. The liability is going to be greatly impacted and increased coming into a post-COVID world, particularly as we look at what are the recommendations from the CDC, what are the recommendations from the PA Department of Health, the Department of Health, and particularly looking at the patients, like how are patients reacting? How are patients, and this is really from your interactions with your patients, but how are patients' interactions reacting to coming into the practice? How are they going to be managed coming into the practice? Those are a lot of questions that really are going to be discussed over the next, I would say, like pretty much the rest of this year. How is everybody else managing this? I know it's kind of shifted from employees, but more towards a risk management.
I know one issue that some of the other practices have talked about is everybody made the huge jump into ramping up telehealth, much faster than they could have ever imagined. And now they're looking at what percentage of their practices are going to stay telehealth and which will switch back into a more traditional visit mode. Are you all seeing that shift back yet? Are you getting a sense that that's really going to change how you manage your staffing? We're seeing some talk about right-size staffing, but what does that really mean? Will your providers actually, not spend time in the office? Will it be more split? Are you going to need fewer staff or more staff? What trends are you seeing there? I see Jessica just joined in. Jessica, if you'd like to join the conversation, you can unmute yourself. Anybody, feel free to unmute, join the video. Just jump in with any topics that you'd like. We've talked about risk management for staffing. We've talked about bringing staff back and how we're managing PPP loans, and just talked a little bit about telehealth. So you guys are a quiet group. Let's go. Who wants to join the conversation?
This is Kathy. How's everybody doing? I missed the very first, probably about the 10 minutes of the conversation, but as far as for telehealth going, I mean, for surgery, it's very difficult to do telehealth. We are able to do it for post-op visits, not all of them, but a lot of them. But we've had patients, limited patients coming to the office during the whole pandemic so far, and we're starting to gear up to see more patients in the office. We're scheduling them further apart. We're trying to schedule one visit and then one telehealth for the doctor so that he still can start to see a little bit closer. I mean, we're not anywhere near it, but closer to the number of patients that he's used to seeing. So we're intermitting that, and then we're staggering at the start times if we're trying to limit it to 2 doctors a session when we used to have 3 or 4 sometimes at a session. So we're only doing 2, and if one starts at 9, the next patient would be coming in at 9:15. Unfortunately for us, our parking lot is under construction. They knocked it down. They were in the process of knocking it down before this happened. So to go, like for a lot of our elderly patients, they would have to park across the hospital and walk like 10 minutes if they wanted to just sit in their parking car, and we could call them. So we really can't utilize that aspect of it. They have to use valet parking, which is the closest to our office, and they can't sit in their car if they're valet. So we're just trying to time the patients as best we can, and as soon as we're also pre-doing their visit on the phone. So one of the MAs calls the patients ahead of time, do the entire visit, but their blood pressure over the phone, so that when they walk, and then we do the front desk also, so that when they walk in the office, all they have to do is give us their card, a copy of their insurance cards, which we scan in, and hopefully we won't have to do that in June. We'll be able to do that, most of that remotely also, and then they just are taken directly back to an exam room, so that we don't have the patients waiting in the waiting room.
That's a good good kind of segue, Kathy. I mean, how are most practices adjusting to limiting the patient interaction from a check-in perspective, and then a checkout perspective, and then from a collections process perspective? Because everything's going to have to shift in some way in the near future. You kind of segued into that, but I think it's good for a lot of practices.
So my name is Jessica. Hello, everyone. I'm from Carlisle.
Hard to hear you a little bit. I'm sorry.
Can you hear me now?
Yep.
All right. So I'm from Carlisle, Pennsylvania. I work for an FQHC, Federally Qualified Health Center. So we're basically like a primary care office. We see anyone birth to whatever. And we actually are seeing about 80% televisits to try and limit the traffic coming through the office. And it's actually worked out pretty well for us We still do have patients coming in the office that need a face-to-face, but they'll have a televisit first with the provider. And if the provider determines that, hey, I actually need to see them face-to-face, then they bring them in. We currently have 2 waiting rooms. We have our normal waiting room that if somebody is being seen for a sick visit, obviously after they're screened to make sure that they don't have any COVID symptoms, they will go through that waiting room. And if they have a well visit, we are sending them around to the building to enter what used to be just an employee entrance. We've modified it to make like a well waiting room. As soon as the patient checks in, we have headsets that we're using to make the MA aware that they're there so that we can get them out of the waiting room as soon as possible and back into a room. And you mentioned about the checking in and checking out process. It's very abbreviated. In fact, when they check out, we use our headset to let the front desk know that they're leaving so that they're not spending any more time in the waiting room than they have to. And then the front desk will call and reach out to them to make their follow-up visit. As far as when the MAs are rooming them, we have also abbreviated that they only take in a pen and a Sharpie, or I'm sorry, a pen and a sticky note in there to document vital signs that they take and whatnot. They have full PPE on. Usually the MAs are in the room a good 10, 15 minutes doing all the screenings and everything before the provider comes in, but we have since modified that to abbreviate the amount of time that they're in the rooms. In fact, we started using the prepare form. So instead of the MAs sitting in the room with them and asking the questions, we're giving them the paper to fill out and then taking that data back out to the desk with us to fill in so that they're in the rooms less time. I'm just trying to think if I missed anything. I think that's basically it for us. I know that right now we are using some of our dental staff to help run that second waiting room. But when we lose our dental staff, when they go back to seeing patients, we plan on rooming our patients straight from the parking lot at that point.
Have you had any trouble getting your PPE?
We at first did, but dental had already had a whole bunch of level 2 surgical masks on hand. So they graciously have shared their supplies with us, and we have had donations of face shields come in. One of my girls that does my supply ordering accidentally ordered a few extra cases of gloves, luckily. So we have tons of gloves on hand. Dental is now running into where they're having a difficult time obtaining gowns.
Mm-hmm.
So I went through our supplier. We use McKesson, and I was able to go through everything that says that it has an allotment until I got to the bottom of the list. There was something on there that did not, and it said that it would ship in 1 to 4 days for the gowns. So I'm waiting to see if they actually hold true to that. That was yesterday afternoon that I placed that order. So as far as N95s, we have a little bit of stock with that, but we're looking to keep increasing that stock as much as we can with the allocation, especially if dental goes back to practicing. And our administration's actually looking at decontamination process for the N95s, and they're starting the contract with, I believe the group is Bartell, where they can decontaminate the masks up to 20 times.
Wow. Carol Thompson, one of our volunteers, is having trouble getting her, I'm having trouble, I guess, getting her audio working. I'm sorry about that, Carol. But she posted a comment that she's noticing an increased number of patients declining telemed because they feel that going out for a doctor's appointment is a valid reason to leave their home. So they're working the system a bit, I suppose. Have you all had people declining telemed visits or preferring them one way or another?
We have in Carlisle, we have a few that have declined, but we just work with them. And, you know, like I said, we try to start with like the provider doing a televisit first. And then if they really feel like they need to be seen in the office, or if the patient just blatantly refuses, even after we try and re-educate them, we bring them in.
We have
We
another
have
new, oh, go ahead, go ahead.
okay, then gonna say we have a few patients that refuse to do telemed, but a lot of ours have to come in. We have in our vascular office, a lot of the vascular surgery patients are elderly, and they don't have the technology, or they don't want to use the technology. So we have seen more vascular than general surgery patients because of their more critical nature of their illnesses. But I would say overall, if we feel that the patient can be done and they have the technology, we haven't had much issue with people wanting to come in, maybe one or two, and then we see them.
Right. We had one new person join as well. He's on the video, but he's hiding, is Mr. Connolly. So everybody feel free to join in. Where should we go next, Nick? Kathy?
So what I would just throw it out to the group. What is a pain point that you all are facing at the moment? Because I think that most medical practices in general, and I don't want to go from a broad perspective, but there are specific pain points that there are specific pain points that are affecting each specialty, but then overall there's pain points that are affecting as a group, and how can we look at it and talk amongst ourselves about what each of us are doing and how we can be able to progress with it.
I would say our biggest struggle in our practice right now is the dental. Obviously with COVID, we have to limit what we can do in the dental practice to follow the state's guidelines for that. And it's for us, being that we're a community health center, we have patients that are that, it's like populations where they, the disparities, like they have the disparities. So it's just putting another barrier in front of their care.
Jessica, are you with Sadler, if you don't mind me
Yes.
asking?
Yes.
So with dental, and I know dental's under a different microscope because of the aerosols compared to medical. Are you seeing emergencies at the moment with dental?
They are. But like I said, with our limited N95s, we've had to look into the decontamination process of them. So we're going to be starting that very soon. I had to put my protocol together for medical. Dental had to put their protocol together for it, and I think they're looking to implement that as soon as possible to avoid wasting the masks.
Okay, and you go through those with McKesson, correct?
Yes. Yes, or wherever we can get them. Unfortunately, another thing that happened was we got a large shipment of KN95s, and then they came out with that new data that they're not up to standards. At first, they were allowing the KN95s, and then I think it was like in the last week or two, they came back and said, hey, these were to be used under emergency guidelines, and now that the effectiveness has been tested on them, they can no longer be used. I don't know if you saw that publication.
Was that through the ADA?
I did not, yeah.
I believe so. So we're actually, what we do is we have masks set aside for our patients, the ones that show up without masks. So we've just put those there for the patients that if they show up and don't have a mask, we're asking if they wear a mask, and we have like a stockpile to give them.
Is that specific to dental, or is that medical too?
For giving the patients masks?
Yep.
That's our facility. As soon as they check in, if they don't have one, we're offering one.
Okay.
Where did you see that article about the KN95s?
My administration shares when the CDC has updates, and I believe it was on the CDC website.
Okay.
I can try and look for it and maybe put it in the chat.
No, I can look on the CDC website. I just wanted to, I didn't see that yet, so I wanted to just check it out. We have some N95s and we have some KN95s that we're supposed to get in from the Pennsylvania Medical Society that were purchased them, and they said they had a certificate that from the FDA and things like that. So they haven't arrived yet, but now that will be curious if they're not up to standard. Then
I would imagine
may-
if they have a certificate from the FDA that they'd be up to standard. I think you definitely want to double check the list, but it depends on the manufacturer, and I'm thinking that a lot of those were made from a different country.
Okay. Is everyone having trouble like with like I can't get Cavi wipes you know anymore? I mean we're pretty good on all of our other supplies except for the N95s, which we're still don't have a large supply, although we don't really use them much in the office, but we now need them due to this current situation. But as far as, you know, I still have some type of Cavi wipes left, but they were allotted to us on McKesson, but I've never been able to get them since this whole thing started, even though they said that we're allotted to them. They just keep saying that they're out of stock. That's my one, I guess, PPE that I'm having trouble restocking on.
Kathy, it's Carol Thompson, and we're also having trouble, but I was at Walmart and they had quite a supply of their brand, but I grabbed a bunch and brought them into the office. I was just this morning.
Oh, okay. Good to know.
Yeah, we actually, before we could get the N95s off of McKesson, which is still a very limited supply that we can get there every once in a great while. We actually had administration go to like Lowe's and Home Depot when this first started, and they were buying boxes of the N95s too.
I guess, what is everyone thinking of doing? I mean, I know we're going to be in this situation for a while, but when supplies get more up to you know, normal level, what are you planning to do as far as for keeping an additional level of supplies in your office for all these problem items that we're now experiencing? I've been trying to think of what, you know, how much we really need to keep so that if we do run into this situation in the future, we have enough without struggling. And then if we do, is the government going to come and confiscate them like they did on some orders? Has anyone thought about that and what levels you may want to keep in your office?
I've thought about, I would have no idea how many we're going to want, but I've definitely thought about that, especially if they get in a situation like this again and they only allocate how much you've ordered in the past year, is what McKesson seems to be doing.
It's Carol. We just actually talked about that this morning when I shared with our clinical administrator that I was able to score a few at Walmart. You know, we don't want to be in a position where we're hoarding, but with the controversy about a potential spike in the fall, we do want to be a little better prepared than we were for this one.
I think
It's
we
also
are,
a space issue too.
yeah, I think we are at an interesting point that we can pause for a minute and think about what we would have done differently. If there's another spike in the fall or into the winter, then what would we have done differently this time? And can we prepare for October or November now?
Yeah, I think what I plan on doing is just continuing to gather what I can for now, since it's such a limited amount that we can get, and we have a designated space for these supplies to keep separate now. That way, you know, at least if there's a spike in the fall, we at least have somewhere to go. I can't put a number on it, not, you know, especially not knowing what's going to be. But
Is anyone having trouble with their staff, and then you may have spoke about this before I came on, but spoke about, any staff members that are still don't want to come back or are afraid to come back to work that might not be working at the present time.
We have our medical assistants, our dental assistants, our front desk staff, they're all working full-time in the office, but I've noticed that our other support staff, like we have, they don't do direct patient care. They seem like they're a little more hesitant to come back. We have a case manager who can do visits over the phone for the most part. The only thing that she'd really have to do face-to-face is when she's like glucometer training or insulin training. We have a pharmacy tech. I have a referral coordinator, people like that just really haven't been out and around to see what we're seeing. They seem to be a little more hesitant, whereas my staff at the very beginning were really hesitant, but now it's almost like they're used to it.
We had a staff member decide to retire. She was kicking the idea around prior to this, and she's so fearful. She's an MA. She's so fearful of touching patients and so forth that she gave her notice.
I have one that was a front desk staff member, and I'm not sure if it was more fear or like lack of a babysitter, but she decided to be a stay-at-home mom to her toddler.
Yeah, I have one assistant manager that just said she's not coming back until this is over, and I'm like, well, now we have to decide what we're going to do. She's been here for a long time, and she only works part-time, but it's not fair to all the other employees who are coming back. And I did the one good thing is that this isn't going to be over for a long time. So I think that she, we decided to say probably give her an ultimatum that she either comes back and works what we tell her to work, or she should retire permanently.
Is anyone currently doing testing at their sites?
We're at a hospital, so the hospital does the testing, but we have to have every patient that has surgery tested within 72 hours prior to any elective surgery, or any surgery no matter what, but before all the electives, they have to be tested prior. And then they have to go into self-isolation from that point on.
We're currently trying to figure out how to implement testing. I think we're starting with the antibody testing, and we have that protocol ready to go. I believe we're going to start that next Monday. And then we're looking at doing the nasal swab testing, but that's going to have to be outside, and I'm going to have to designate a staff member to do that. And I'm like kicking around the idea. I heard that a lot of FQHCs are only having either an LPN or an RN do it because they were seeing that results from MAs were not as consistently collected as the ones from the LPNs and RNs. But I currently do not have an LPN or RN, and I feel like if I train a certified medical assistant that I can trust to do it, I feel like that might be a good option. It's just a matter of how do you pick who's going to do it.
Now, are you talking about testing all of your patients or your employees, or what are you looking at doing?
We're going to start by testing patients only and seeing how that goes. And also, if some of our employees, because of the type of health center we are, some of our employees are patients, so we would test them or give them the option to be tested there. And then hopefully, eventually, if that goes well and we have the capacity and the amount of kits, we'd like to do testing for the community. I think they're actually looking at getting a mobile unit as well.
Now, the testing that you're looking at, is that the rapid testing or
Through
just, or
Quest.
okay.
Yeah, I can't get rapid testing yet. I'm still waiting for it to be available. Every time I look on McKesson, it's not available, and which I haven't looked this week, so maybe it is this week. And I also need to look to make sure that it's FDA approved and approved for CLIA waived labs. And apparently there's only one test out there right now that's approved for CLIA waived labs.
I'm curious if you all think that, I'm sorry to take it back to staffing again, but if you think that the change in childcare and school issues in the fall and starting in September will be a hardship on your staff, and if it's something that you all are thinking about.
I think so. It's definitely in the back of my mind. You know, I even have to think about my own personal life and my own children, and I'm fortunate enough to have older kids, but even the remote learning has been difficult for me, being a full-time employee, as well as my husband's a full-time employee, so it's hard to find that time to sit with your kid and actually help them do the remote learning.
I think the remote learning is even more complicated than just the childcare issue. We have a staff member whose son is in first grade, and he's required to be kind of in the remote classroom from certain hours. So it's not even like she can take him to a daycare or a babysitter during the day and sit with him in the evening to do his work. He's required to be there, and she's having difficulty finding someone who will accept responsibility for that.
I would agree with that. And I have 3 girls, and the middle one is in first grade, and getting them to focus is a full-time job in itself to online learning. And I think that definitely rings true with a lot of parents that are currently going through having to get them to sit down and feel comfortable with having their children go through that type of online learning. I can't even imagine the high school age kids or the middle school age kids that I know they don't require the parent touch as much, but definitely getting them to be focused on a more impactful level is probably even harder for them.
Yeah, I can tell you,
Well,
my middle schooler is definitely less focused. So I have to constantly each night, what homework do you have, this and that, and follow up constantly. But my oldest, she's a senior, and she's always been self-driven, so she's one that I can just kind of let go. And I did fortunately have her help a little bit with my middle schooler, but not everybody's so lucky.
and I don't know about any of you, but my daughter has homeschooled my grandchildren for many years. And she had to be out of town. She and her husband had to be out of town. So I took off of work and spent 2 days with the children. I could not do 5th grade math. Now, I have a master's degree. I couldn't do 5th grade math the way they do it now. So I'm thinking about all the parents who are having to fill in as teachers, and things are not the way they were when I went through school, for sure.
We're
Personally-
also having issues. Oh, go ahead.
No,
Go
well, I
ahead,
just hope that they make a decision and tell us what the procedure is going to be far enough in advance so that we can problem solve on it, so that we can know how we're going to manage our jobs and manage our kids and manage the office staff and how it's all going to work. You know, if they tell us August 15th, this is what school's going to look like, it's going to make September 1st really hard. So I hope that they can give us some notice so that we can plan accordingly. That's my biggest fear, is that we won't have the notice.
Agreed.
Yes, and I just wanted to chime in on that because I've actually talked to our principal, and they're preparing even in the fall to have kind of a almost like different cohorts of kids going to school. So like some kids, it just doesn't sound like it's going to be the same, you know, when they start back at the end of August, if they do. And it may even look like, you know, certain kids, you'll go to school for a week and you could possibly stay home for a week. So it sounds like it could be a combination of virtual and on-site learning, which I agree. I think that it's hard to predict what's going to happen, but you do need some planning time, especially in households where both parents work and you need to arrange childcare. So that presents, you know, a whole other set of challenges.
And I'm curious, I mean, the EFMLA had provisions for parents to be away from their jobs if they had to provide schooling or childcare. I'm wondering if they will extend some provision for that. It would seem like they would have to if large numbers of states are not going back to full-time in-person schooling. It would seem that they would have to allow parents to provide that care. If the goal is not to then just dump the kids back into a daycare setting. I can't figure out how it'll all come together, but if they extend that provision of the EFMLA, then we're back to having staffing issues because staff want, you know, have that ability to take time out of the office.
Yeah, right now I'm a little concerned with, you know, for summer with the daycares, like how, you know, what effect they're supposed to open up July 1st for summer camps and things like that. And you just wonder, will they be able to stay open? You know, will they be able to, you know, meet all the rules and regulations that are required to be open? And for the kids, I have a couple people that have kids going into camp as of July 1st.
Mm-hmm. Well, I would like to, oh, go ahead, Nick.
I was just going to say another challenge to that is that right now, a lot of these parents who may or may not have a 2-income or a 2 household are currently working possibly from home. And when they go back in the summer, like Kathy had said, it's going to raise new challenges about who's going to be watching the children, particularly if daycares are limiting the amount of people, the amount of kids that are going to be in the daycare. It's just going to bring up a whole new set of challenges. And they're not going to have the distance learning, but they're going to have who's going to watch their kids during the day. To be honest with you, it's going to be a challenge.
Talking about, like, I guess employees not able or willing, has anyone needed to hire somebody, and are they having challenges in getting anyone interested in working in healthcare, especially?
Well, we have hit the 45-minute mark on our call right now. We are going to be getting back together weekly, and we have a large number of people who've registered for the call. So I think that the group that's meeting weekly will change, which will be interesting to hear different perspectives. So I would invite you all to join in as you're able over the next few weeks. I believe Nick is going to moderate for us again more formally next week, and I appreciate that. Thank you for your help, Nick, and Kathy and Carol. I appreciate your help. I want to thank you all for joining us. Could you, if you all have any questions or hot button issues that you'd like us to be sure to discuss in future conversations, please let us know either now or in the chat box. We're happy to make sure we hit on those issues that are important to you all. I thank you very much for your participation today. I hope that you can join us again soon.
Thank you.
Thanks, Erin.
Thank you, everybody.
Thanks.
Thank you.
You too. Bye-bye.
Bye.